All right, welcome to our live stream. I'm Dr. Deuk, CEO and founder of Deuk Spine. It is October 10th, 2023. That's our last case of the day. Our patient is actually from Romania originally. He's now here working as a truck driver, and he told me he's done 2 million miles of driving his truck. Spends a lot of time in the cab, but he's been having back pain. And we know it's coming from 2 discs in his lower back. The number 4-5 and the 5-S1. So what I've got to do is I've got to navigate my way down to those 2 discs so I can fix them for him and get him out of pain. All right. So I'm going to start by placing the needle shot. And I'm using an X-ray machine, which is a special tool we surgeons use in the operating room to basically get to the disc that needs to be fixed. Shot. You could see he does have some short pedicles here at 5-1. AP. Num. Skin. The nice thing about the surgery we're doing is it's called minimally invasive, meaning that we are going to make a very small incision, 7 millimeters to be exact. And there's almost no bleeding, just a few drops of blood. Let me know when he's awake, Dr. B. In the meantime, I'm going to place my next needle. Is he awake?
Maybe do the next needle and then
Yeah, that's what I'm doing right now. No worries, Dr. B. To be or not to be. All right, we're streaming.
Yes, we are.
Why don't we start by showing our audience a video of how is it that somebody can have a disc injury and it causes so much back pain? What is the mechanism? And you will know the answer too after you watch this video. Go ahead, Sanjay. Where do you have pain, my friend?
Pain located. Your back or your legs? No. His in the back.
Perfect. All right. My friend, everything is going 100% perfect right now for you, okay? I'm going to put you to sleep in just a moment. But you're going to want to watch this someday and see what happened, okay? So first of all, we got into the 2 discs, no problem. L4-5, L5-S1. All right. We've lost literally 1 cc of blood so far, so almost nothing. Are you comfortable? Are you comfy? All right. Now you know what happens next. How bad is that on a scale of 1 to 10?
Give us a number.
What's the highest?
5.
No, come on. You almost came off the table. What's the highest?
6.
Okay. Is that where you typically get pain? Congratulations, we found one of your bad discs. Is it better now?
Yes.
All right. You don't have to tell us a low number if it is a high. I see you jumping off the table.
That's a.
How bad is that on a scale of 1 to 10?
Don't move your hands.
What's the highest it goes?
7.
All right, no problem. No, it's just funny because, right, that's pretty good. We found your 2 bad discs, okay? We're going to put you to sleep. When you wake up, your surgery will be done. He's very stoic. We call stoic. Stoic means that he is tough and minimizes the pain. But you could see when I injected, his whole body tensed up, and you could tell he was feeling pain, right? It was pretty obvious. So the good news is we found his 2 painful discs. We're going to fix them now. Now, Jordan, show us on that video, on the x-ray, show us the tears that we talk about, the posterior annular tear. There it is, right there. And there it is. All right. Oh, let's start with 4-5. That way 5-1 has a clean, you know what I mean?
Yes, sir.
You going to let Nikki over here?
Yeah.
Let her over. Let her over.
Okay.
Huh? You gotta make her work. Keep your hands in the right place. Come on over. All right. Okay, we are ready to rock and roll. We have added Nikki to our team, shot. And she's loving it. Shot?
It's like doing a nose on Madison Avenue.
Shot? I don't know. Is that the guide wire, you think? Yeah. That's what I'm seeing. Don't be reaching for things until I put it where you need it, okay? All right, we got our guide wire in. We're going to do L4-5. Look at the size of that tear at L4-5. It is huge. Can you say huge? Huge. It's huge. Shot?
So num first.
Let's do some num-num. Remember, when I take it, you want to keep your hands clear. Any questions from the audience?
No current questions.
So Sanjay, let's show our audience the video on how this Deuk laser disc repair actually works. What does it do? Welcome back. You can see from that video how the Deuk laser disc repair surgery actually works. We're inside the tear that allowed the herniation to come out. And that tear is the source of back pain. We discovered that at Deuk Spine Institute 17 years ago. And we've been talking about it now for 17 years. We're the first in the world to discover the posterior annular tear is the actual cause of chronic back pain in about 85% of people with chronic back pain. Fix the tear, you fix their pain. So the days of doctors saying we don't know what causes back pain, those days are numbered because of our work here at Deuk Spine. At Deuk Spine, we never say we don't know what causes the back pain, because we know every single patient, every single time. Unfortunately, not everybody has our ability to do that. So you're going to have to come to Deuk Spine if you want to know why you're having back pain.
Not everyone examines the patients like we do.
Not everyone examines the patients like we do. And honestly, I didn't examine the patients like that all the time. There's the herniation.
Wow.
There it is. You guys see it?
Yes, we do.
Yeah. All right, check it out. Look at that thing. Put the nice job, Nikki. Whoa, we got a 3 centimeter here. That is incredible. 3 centimeters long. 30 millimeters. Congratulations on your first delivery.
Thank you.
Of a herniated disc, that is. Pretty cool, huh? Yeah. Now you know why the guy was hurting so bad. And that wasn't the only one. Just about ready to bring in the laser. Good. Remember, it's a pinch. You're pinching. Pretend that this thing's having a nosebleed, right? You want to pinch it. There you go. That's perfect technique. I could feel it. You believe it or not. Can you tell? Isn't that amazing? That the surgeon can feel how you're grabbing it? I could close my eyes and tell you if you're grabbing it properly. Yeah, that's pretty good. All right, Sanjay, any questions from our
Yes.
audience?
We have a question from Earthbody Official.
Okay.
He says, if I got a whiplash at 6, would that have caused something 30 years later?
Yes.
Or is a child's spine much more resilient?
No, everybody that has a herniated disc or injured disc had some type of trauma in their past. And most of the patients I talk to, they don't remember when it happened. They say, I don't remember. But many of them do. And they remember it was a car accident or a slip and fall or an injury on the playground when they were a child. Something, some type of accident or injury. And it can even happen when you're being born. When the OB-GYN, the doctor, is delivering the baby from the mother's birth canal. They can pull on the head, pull on the body, pull on the legs. They don't realize they could be causing damage. You know? Sometimes the baby is in fetal distress, we call it, meaning that they're going to die if you don't get the baby out right away. And so they pull as hard as they can and they get the baby out. And you've all seen this, right? Well, that pulling on the baby could definitely cause an injury to the spine. So, of course, if you ask the OB-GYNs, they'll tell you, no, that wouldn't cause an injury, but yes, it would. I've seen so many young children, 2 years old, 3 years old, babies, that have herniated discs at their age. And they have good parents. The parents did not abuse them. So something happened to cause trauma. Well, the only thing that the parents, they know of nothing, you know. In a 2-year-old, you know when something bad happens to a 2-year-old. You can remember it. You're the parent. Okay, you're with them all the time. So what's happening is that these parents are saying, I don't remember anything happening. Well, that means it happened when the baby was being born. And I've been involved in deliveries. When I was in medical school, I saw how hard the surgeons pull, or the doctors pull on the babies to get them out when they're going to die. You know?
We have a series of questions coming from
Sure.
Earth Body Official on YouTube.
Yeah, that's fine. I'll take them.
What complications do other
Don't
lasers
hold, just grab and release. What is it? What complications do other?
laser surgeries have versus DLDR?
That's a great question. Somebody's saying, what complications do other laser surgery have versus DLDR? So first of all, I'm not aware of any other laser surgery. If you know, tell me. I would like to know. There are not many surgeons who use a laser during surgery. And the main reason is they don't have the ability to do so. They may have a laser, but they can't use it properly because they don't do endoscopic surgery. So to be able to use this laser properly, you must also, besides doing laser surgery, you must do endoscopic surgery. So you have to do laser endoscopic surgery. And 99% of spine surgeons don't do laser surgery, and 99% of spine surgeons don't do endoscopic surgery. So there's only a small number of spine surgeons that do endoscopic surgery in the United States. There's more surgeons doing endoscopic surgery in India and in Korea and in China because they're more advanced right now. Unfortunately, American spine surgeons are stuck in the old ways of doing spine surgery. Laminectomy, microdiscectomy, fusion, artificial disc. So if you ask me, in the United States, Deuk laser disc repair versus other types of laser spine surgery, I don't know of any other laser spine surgery being done in the United States. If you ask worldwide, I don't know what those other doctors do. I would need to watch their surgery and see what they do. But they don't show us their surgery, do they? They hide their surgeries because they're afraid that people will see their mistakes. Most surgeons don't show their surgery because they're afraid they don't want anyone to see their mistakes they make during surgery. That would be very bad if the lawyers could see what kind of mistakes they make, because then they will get sued for not doing the surgery right. So for us to show our surgery, it means that we're very confident that the surgery we do is good surgery. We're not afraid to show people what we do. We show you the whole surgery from beginning to end. So I don't know of any other laser spine surgery. If you have a specific surgery, send it and I'll look at it and I'll tell you what we do different. What I can tell you, the Deuk laser disc repair is different than most spine surgery because we don't remove the bones and the ligaments from the spine. Other spine surgeons do, which is going to damage your spine. You don't want that damage. Spine surgery itself is damaging. It's like war. When you go to war with a country and you shoot the guns and the rockets, you're damaging buildings. You're damaging people. You're damaging the earth. Well, when spine surgeons do these open spine surgeries, they are damaging your spine. Deuk laser disc repair does not damage the spine at all. It's like winning a war without actually destroying anything. We're treating the part of your spine that's already damaged. So we're not creating more damage, we're helping it heal. So there is no surgery in the world like this surgery. And if anybody does the same surgery, well then they're copying us, because we're the first to do this. And I know there are surgeons who are trying to copy our surgery out there. Nothing wrong with that. It's good that they're trying to help their patients and do a good job. All right, what other questions do you have for me, Sanjay?
Yes. So, how can you be sure whether some of the pain doesn't come from the facet joint capsule pushing from the other side?
Yeah, that's a good question. So the only way to be sure is to ask the patient after we're done treating them. So what we do is we'll look at the patient before surgery. I'll do exam. If I see facet capsule pain, I will tell the patient I see facet pain and it needs to be treated with Deuk plasma rhizotomy procedure. On the other hand, if I don't see facet pain, I tell the patient, listen, you may have some facet pain. It may come after your surgery. We just don't see it before. And if it comes, then we have to treat it. This is all damaged disc and herniation here, all this stuff. Okay?
The next question is it possible to use the pincher instead of the laser throughout the whole procedure?
Is it possible to use, I didn't hear what you said, something instead of pincher?
Yeah, he said pincher.
No, it's not possible to use the pincher instead of the laser. The pincher is what other surgeons would use, and it doesn't work. The pincher is only useful to remove pieces that are too big. So the laser is the one that does most of the work. You can't do this surgery without the laser. If you do just the pincher, then maybe you help the patient's leg pain. But the back pain is what we're treating with the laser. Remember that. This patient, he doesn't have leg pain. So the pincher would not fix his problem. Only the laser can fix. You see the herniation there?
Yes, we do.
The grabber, we call it a grabber, we call it a pituitary. The rongeur, the pituitary rongeur, will not get rid of back pain. Only the laser can get rid of back pain. There's no other tool. Right, Luis? All right.
We have a comment from Earthbody Official on YouTube.
Uh-huh.
Dr. Tony Mark does endoscopic laser through the front of the neck and transforaminal lumbar. Dr. Carl Kim in LA does endoscopic laser, but only lumbar, I believe. Transforaminal.
Yeah. I don't think they do. Do you watch their surgeries? They may tell you they do, but I don't think they do. I know Dr. Mork. I know Dr. Kim. I know both of them. And they don't do what we do. They do a foraminotomy where they remove bone and ligament from the spine.
We have a comment from Janet Parker on Facebook.
Uh-huh.
This is the absolute best back surgery.
Yep.
Greed rules the other back surgeons in our country.
I appreciate your sentiments. Thank you. I agree with you. It is the best. I didn't hear the second statement, though, Sanjay.
Greed rules the other
yeah.
back surgeons in our country.
Yeah, you're right. You're right. That is the problem. The problem is that, and it's not only the surgeon's fault. The problem is that the companies that manufacture and sell the screws, rods, cages, artificial disc, those companies make billions of dollars every year selling those products. So they have now gone to our schools where the surgeons are being trained, and they're bribing the professors to teach the residents there to put their screws and rods and cages inside the spine. And anytime you go now for training in the United States, that's what they're going to show you. They're going to teach you that fusion surgeries. They won't show you the endoscopic. The companies won't allow it. As a matter of fact, This surgery was supposed to be shown 10 years ago to all the neurosurgeons through the American Board of Neurological Surgery. We need our irrigation working, guys. How are we doing on irrigation? Is it low? Okay. All right, thanks. And I produced an educational video for the surgeons, neurosurgeons. It was taken to the board, and the board members said, no, you cannot teach other neurosurgeons this surgery. And they told my friend, who is in charge of the educational videos for all the neurosurgeons in the United States, that if he didn't listen to them, that they would fire him. So he didn't tell me the names of the people, but I understood what he was saying. It looks like we're out. Did you guys just switch? No. No, it keeps stopping and then going. So, not sure what it is. All right, very good. Well, I'm happy with that. There's the nerve right there. Right there, you see the white thing?
Yes, we
That's
do.
the nerve roots. It looks good. Look how the hole is almost 2 millimeters. That's it. So it's already closed. Here. That's because it's a fresh herniation. Okay, we're done with this one. We're going to go on to the next one. Yeah, you can see the tear there. Sometimes when a tear is an old tear with an old herniation, it's 3 or 4 millimeters wide when I'm finished. But this one was almost completely closed when I was finished. It's just because his disc is not as damaged as some of the other ones. Careful. All right, let's ask some more questions.
We have a question from Earth Body Official on YouTube. What pump pressure do you use, and how do you prevent the cerebrospinal fluid and intracranial pressure?
Great question. So, I'm not sure who's asking that question, but that's maybe a surgeon. We don't use a pump, right? Or do we use a pump? No. We use a pressure bag. Yeah. So the question, it's a good question, is being asked of me is the irrigation that we're using. A lot of surgeons would use a pump. Pumps are expensive. They cost several $1,000s. And we actually, to save money, we use a pressure bag instead, right? Yeah. And so in the beginning, when I first started doing these surgeries, I didn't buy a pump because I couldn't afford it. I didn't have the money. And we were using a saline bag with a pressure cuff. And I used that for many years, and it worked fine. Of course, the company is always trying to sell you the pumps. They're always trying to sell you things so you spend more money. And I always looked and said, do I really need to spend it? And I knew that there were surgeons that were doing the surgery without the pump. So I figured out how to do it without the pump so I could save some money. But we've tried buying the pump. We've tried it, and it doesn't create enough pressure for us. So right now we're using just, what is it? ConMed pressure bag. It's made by ConMed Linvatec. C-O-N-M-E-D Linvatec, which does endoscopic stuff. And it's the just a pressure bag. All right. So good question.
We have a comment from Janet Parker on Facebook.
Yes, Janet.
All spine surgeons would learn to do this if they cared about their patients.
I agree. I agree with you. 100%. I agree with you 100%. It bothers me. And I have gone around the world trying to teach them. I've been to Hong Kong. I've been all over the United States. And we broadcast our videos so we could teach them. But I'll be honest with you, I've given up on trying to teach the spine surgeons. No, hold on. Because I feel like they don't care. You know, they just want to do the fusions, the laminectomies, the spinal cord stimulators, all the devices that make so much money for them. But you're right. I think if they did care about their patients enough, they would find better ways to treat them.
We have a question from Felix on YouTube.
By the way, for those of you who have never seen this, this tube is like a straw made from metal. This is the whole tube we do the surgery through, 7 millimeters wide. We just slide it over the dilator, and then I use an impactor to drive the tube down into the disc through the tear. Remember, we're going not through the normal disc, but through the damaged disc. We're not making more damage, we're going through the damage that's already there. Perfect. All right. This is it, our last disc. You can see there's no bleeding, just a small incision, and there's no metal, there's no biologics, there's no fusion, there's no cadaver bone, nothing, natural. This is a natural way to fix the herniated disc that cause pain. It's better than any other treatment in the world. You can buy the metal, you can buy the plastic cages, you can do all that, but you won't get as good a result. The patient will have pain or complications. With these surgeries, they do fantastic. All right, you have more questions, Sanjay?
Yes, we have a question from Felix on YouTube.
Uh-huh.
Hi, Dr. Deuk. My
Hello.
name is Felix.
Nice to meet you.
I'm excited to see you this Friday to tell my horror story on previous ALIF, L4 to L5, and ACEDF, C5 to C7 story.
Fantastic. So what Felix is saying is that I'm meeting him Friday, because we do some telemeds on Friday, which is our free virtual consult. And Deuk Spine and myself, we offer for anybody out there, they get one free consultation, no charge. All they have to do is give us their MRI, the images and the report, and then I meet them and I spend 10 minutes talking to them to learn more about where their problem is, make a diagnosis, and then I give them a treatment recommendation. All for free, okay? And we call that the Deuk Spine MRI review. We've been doing it now for 5 years, and we've helped many people get a diagnosis. Not everybody can come for treatment, but at least the people get a diagnosis. They know what's wrong. They know what needs to be done. I had one patient who I did the review in clinic, not MRI over the internet, but clinic. They came 10 years ago. 10 years. And they wanted to do the laser surgery, but their insurance did not cover. So they waited 10 years and they saved their money and came back and had it performed. I was amazed. I said, where did you go for 10 years? They said, I wanted to have your laser, but my insurance wouldn't cover it, so I saved my money and I came back and got it done. I was amazed. So my point is, just because you can't be fixed today doesn't mean tomorrow you can't be fixed. Maybe tomorrow you can. And our company is always working, trying to get the insurance companies, more and more insurance companies, to cover the services that we do, because not every insurance will. And my belief is, I don't want to take any money from the patients. I want to be able to do this surgery for free for the patient. And if we could do that, then nobody would have back pain anymore. We just need to get the insurance companies to pay consistently. And that's our biggest obstacle right now. All right, what other questions do you have, Sanjay?
We have more questions coming from Earthbody Official on YouTube.
Sure.
Returning to my question about
5 minutes.
diffuse discs that have long annular tears, how can the disc possibly keep its structure to stay strong and or heal?
All right, I couldn't understand the question. Maybe you can repeat it for me.
Returning to my question about diffuse disc
Yes.
that have,
Diffuse disc annular tear and disc bulge.
yes,
And
How-
what's the question?
how can the disc possibly keep its structure to stay strong and or heal?
Well, it can heal when you clean out the tear and you remove the herniation. All right, look right here. You see the blue thing right there, the baby blue color? That is the herniation. It is stuck inside the tear. As soon as I remove it with this laser, the disc can heal. The very minute that I take this away, the next minute the disc will start to seal and close. Okay? That's why. The problem is your body cannot do this itself. It needs my help.
The next question, what's your opinion about prolotherapy or ozone?
Yeah, prolotherapy just doesn't work. I've never seen it work. Now, the doctors will frequently put a steroid injection with the prolotherapy. So the patient thinks it's working, but it doesn't. I've never seen prolotherapy work in any patient that had it. Never. And then ozone, it doesn't work. Doesn't work at all. If it worked, we would do it. But we don't offer those treatments because they don't work. We don't, Duke Spine Institute will not do treatments that doesn't work. We're against it morally, ethically. It's not right to offer treatments that you know is not going to work when you have treatments that do work. The problem is most doctors, they don't have treatment that works. So all they have is treatment that doesn't work. So it doesn't matter if they do one treatment that doesn't work or a different one. They're going to offer you lots of treatments that don't work. We're not going to give you a treatment that doesn't work. I don't need money that much that I'm going to cheat somebody out of their money for a treatment that doesn't work. It's wrong. We've never done that and we never will. I don't care. Even after I die, it won't happen. It's one of the beliefs of our company is to be honest with patients. To get back to that where patients can trust their doctor. To make the right choice for the patient, not for the doctor, for the patient. There's too many doctors out there that are doing procedures on patients' backs and necks that don't work. And they take their money and they can even hurt the patient during the procedure accidentally. They have a complication. Because these procedures, they're not without risk, especially doctors that are not so good. You know, they make mistakes. And then the patient has to pay for the mistake the rest of their life. And that's something I don't want it on any of my patients to have. You know? This is the safest surgery in the world for the disc. There is nothing safer. We have the lowest complication rate of any surgery in the world. Less than 1 in 1,000 patients will have a complication with this surgery. All right, what other questions you have? About 3 minutes until we're done.
We have a question from Earthbody Official. If cervical discs are smaller, do you use a different size dilator or
Yes.
tube?
Yes, great point. We do. Cervical discs are smaller, and we use a smaller dilator and a smaller tube. The cervical discs are done with 4 millimeter tube, 4. The lumbar is done with 7, almost twice as big. Also, with the cervical, we use a different scope. We use a fiber optic scope. It doesn't have as good optics as this one. This is a rod lens scope. Inside the tube, there's little lenses. They transmit the image up to the camera. With the fiber optic scope, they have fibers, glass fibers, just like the one you see here with the laser. 1 minute left.
We have a question from JMC on YouTube.
Sure.
Any thoughts on CRPS?
Yeah, complex regional pain syndrome, CRPS. It's a very difficult condition to treat. Complex regional pain syndrome used to be called reflex sympathetic dystrophy, and it comes from damage to the nerve roots. And what happens is the patients, they can't feel their foot or their hand, and when they walk, they smack the foot, and it traumatizes the foot, and all the joints and soft tissues get trauma from, because they can't control it properly. So it creates a feedback of pain, joint dysfunction, joint swelling, joint stiffness, joint pain, soft tissue pain. It's horrible. And it's all regulated by the sympathetic nervous system interacting with the somatic nervous system at the level of the nerve root. Yes, we have treatments for it. It's called a sympathectomy or sympathetic ganglion block. And we do that here. Dr. Patel is the one who does that treatment. So if you have complex regional pain syndrome, you can come to Deuk Spine, see Dr. Patel, and he can do a block. If the block is successful, then we can do a treatment that's more permanent. 1 minute left.
We have a question from Earth Body Official on YouTube. Do bone spurs have osteoclastic instead of osteoblastic behavior? If you can improve posture?
Yeah, the bone spurs have nothing to do with posture. Bone spurs have to do with damage to the soft tissues and your body producing bone spurs through osteoblastic behavior or a lack of osteoclastic behavior. I don't know exactly the mechanism. I don't know if anybody does. But a very common problem. Bone spurs are rarely symptomatic. I don't normally treat bone spurs, not by themselves. They rarely ever cause symptoms. Maybe in 100 patients, 1 or 2 will have bone spurs causing the problem. It's usually the annular tear and the herniated disc. All right, we are done. Everything went very well. We finished fixing the 2 discs on this patient, and he's going to have to take it easy for some time to let the 2 discs heal. But now they can heal. The second disc was not like the first one, right? The first one had a very small tear at the end. The second one was more degenerated. It was more dried out with more scar tissue and calcium, and it didn't seal over as much as the first one. So that's just a function of how much damage there is to the disc. The more degenerated a disc, then the more collapsed and dehydrated it is. He'll still have a great result with both. The surgery works for both types of disc injury. All right. Type your questions up. I'll come and answer them for you. But we are finished. And this patient will spend 1 hour and then go back to his hotel. Great job, team. I got it. You can help Luis break everything down. All right, Sanjay, let's show our audience one of our past patients who had this surgery. Good morning, I'm Dr. Deuk Majan at the Deuk Spine Institute here in Melbourne, Florida, with one of my patients who traveled from California. He's been suffering with his lower back pain for years and found us on the internet and decided to come here and have the endoscopic Deuk laser disc repair. We performed that 12 hours ago, and here you are, ready to go back to California, it looks like. How do you feel?
I feel great. It took a long time to get to you. Surgery was quick and painless. I don't remember a thing. Your staff was wonderful, but I am pain-free.
That's awesome. Yeah, and you're going to stay pain-free. We don't have you on any pain meds. We don't have you on narcotics, killing your pain. We didn't put any medicine in your back to stop your pain, so what you have is natural. And do you feel that pain anymore that you had before you came here?
No, the pain is completely gone. In fact, I quit taking my own pain pills 2 or 3 days before I got here. And I am on no pain pills at all, and I feel wonderful. When I woke up this morning, it was a different day, and I feel great.
And I feel wonderful for you for doing that. That's why we do what we do. We can cure pain, and we want everyone to know that, because nobody should have to live with pain every day. How does pain affect your life every day?
Pain is traumatic. The kind of back pain that I was suffering put me in bed. And for the last 3 months, I have been absolutely useless. Absolutely useless. And so I found you. It took me a few months to get here, and it was worth the trip.
It will be for the rest of your life.
Absolutely.
Worth the trip. Pain robs us of our dignity, doesn't it?
It does. It absolutely does.
And your parents are here, and they're very supportive. And that, to me, is so important, that you have people that understand what you're going through. I'm sure your parents have been a big support for you.
Oh, absolutely. Yeah, I was at work, a short story. I was at work last Wednesday dealing with this pain, and my back finally gave out to where I literally could not walk anymore. And I was 600 miles from home. And so I called my mother and father. They flew to San Diego and arranged the trip to get here. I called your place. I was scheduled for February 2nd, and I asked Richard on the phone if he could get me in sooner, because I was desperate. And you guys got me in a week or two sooner, got me in the 24th, which was yesterday. And so we made the arrangements, and I flew here, stayed in the hotel for a couple days, and was operated on yesterday. And yeah, it's well worth the trip. I apologize for getting emotional, but it's been a long trip to get here.
Well, we want you to get emotional, because it is an emotional thing. When you've been burdened with this pain for so long, and then suddenly it's gone, and you realize that life can be lived without that pain, you know, and that you can actually have a life without the pain.
Yeah.
So what are you going to do now that you don't have the back pain anymore?
Well, I'm going to get my life back together. I've got a new job, and they've saved it for me. My boss is wonderful, and I'm going to go back to work tomorrow, actually, if you can believe that.
Yeah.
And I'm going to start riding my bicycle again and getting healthy again.
Well, your surgery went very well. I don't know if you've watched it yet, but we were able to get in with a tiny 7mm quarter-inch incision and fix both painful discs, and they were both very painful for you. And the pain was coming from a small tear that's located in the back of your disc where your herniation came out of. And that tear was just so inflamed, and we were able to clean out the herniation that was stuck in your tear and use the laser to debride it. And that's what the Deuk laser disc repair is. It's a debridement of the annular tear to eliminate back pain and leg symptoms. So we also have a cyst. We didn't treat your cyst. And do you think the cyst is causing any problems for you?
At this point, no. I don't think so, because all of my symptoms are gone. This morning when I woke up, I was a little nervous about getting out of bed. But that subsided quickly when I stood up and could stand up completely erect with no pain or bindage feeling in my back.
Yes, when I walked in and saw him this morning for the first time, the first thing your mother said was, "Look how straight he's standing." So they must have watched you suffer for a long time.
Oh yeah. Yeah, my mom's a great lady. I'm blessed to have her in my life. And then that's my stepfather, Jerry. He's a wonderful man. He and I are pilots. We fly together. We do a lot of things. And he's seen me go downhill. He knew something was wrong, you know.
How did you find out about us?
I've been seeing a chiropractor in Sacramento for 35 years. And 2 months ago, I started to really feel bad. And I would go to him. And after about a month of going to him, and going to my doctor for some pain management for these symptoms, I finally figured out that something else was wrong with me. And so I asked the chiropractor, what can we do? Because what you're doing is not helping me. My doctor put me on pain meds, and they took some of the sharp pain away, but nothing was helping. And so, being kind of a mechanical engineer, I decided to look into how my back was put together. And I requested an MRI from my doctor and from my chiropractor. And so that took 3 weeks to schedule. That's a long story. And I finally got an MRI, and I looked at it myself and realized that I had a cyst of some sort and that I had some problems with my lower discs. And that's when my chiropractor told me about you. He said, get on the internet and do some research and then call these people. So I called your store. They gave me some information. I FedExed my package to you guys, and a week later you called me. And about a week or two later, I got here.
Wonderful.
So, yeah.
And here you are pain-free for the first time in many years.
Many years, many years.
Congratulations.
Yeah. Thank you.
Is there anything you want to say to your fans out there?
There is. This is a miracle. In Sacramento, everybody that I know said, why are you going? Why are you going to Florida? Why don't you find somebody in Sacramento? And I said, well, because I was referred to Dr. Deuk Machen, and I've done a bunch of research on him, and I just have a great feeling about him. Not only that, he personally called me on the telephone because I told his people that I had some questions, and that's what sealed the deal. And so it took a while to get here, but it was worth everything. And I would recommend anybody send your MRI to this guy, and if he can help you, he will. Okay? Thank you, Doc.
You're welcome, sir. It's my pleasure.
Yeah, absolutely.
All right, go enjoy the rest of your
All right,
life.
thank you.
Good morning, I'm Dr. Deuk Machen. It is March 1st, 2023. I'm here with a patient who traveled to Florida from Iowa. He has been suffering with back pain for years. He started to have leg symptoms in his left leg. That lasted for a few years. Then it switched to the right leg, right?
Correct, yep.
And you said, enough is enough, I need to get this fixed. And yesterday you had the Deuk laser disc repair, which is the endoscopic surgery with the laser repairing the damaged discs in your back. And you're here today, less than 24 hours after surgery. How do you feel?
It's almost unbelievable. And I'm typically kind of a skeptical person. So it's like, okay, something doesn't seem quite right, because I have no pain. I took no pain medicine. You know, went from my left, which I had for multiple years, and then it went to my right and went down, made the outside of my calf numb. I can't wiggle my toes, and my foot wanted to roll. And we had the surgery, and I woke up and felt great. And you know, I got up in recovery and walked around, and I could already tell my foot wasn't wanting to flop and roll. Now I still have a, you know, and even on the left, I had some sensation here that's, you know,
Coming
that
back.
was kind of numbing, and it's starting to come back. Again, I'm skeptical. It's like, okay, how much is this as placebo? You know, because I was telling Dr. Deuk that I don't get it, because, you know, he cut my back, he pounded a rod in there, did 4 different levels, and I have no pain. It's just incredible.
Yeah,
And
it is incredible. That's why we're trying to share these stories with the rest of the world, so people could stop living with the problem or stop having bad spine surgery elsewhere.
Yep. And I went back to the hotel and walked around the outside of the building probably 4 or 5 times. And typically I would start feeling some back tension then. Nothing.
Yeah, it's gone.
It's gone.
It will be gone for the rest of your life, as long as you don't re-injure it. Let it heal. Yeah, he woke up yesterday and I came to visit him in the recovery area, and the first thing he said is, "This is amazing, but it must be the medicine, right?" And I said, "No, we haven't given you any medicine that would do that. The propofol we give, which is the sedative for the surgery, it's not a painkiller. It only puts you to sleep. So you'll still feel pain even with the propofol." Basically, the results are legitimate and genuine. And that's what our patients experience with this procedure.
It's amazing.
So what did the back pain and leg symptoms, how did it restrict your quality of life? Tell us a little bit about that.
Oh, you know, again, over the years, you know, it would kind of, I'd hurt and I'd have to lay down and not do much. And then here towards the end, I couldn't walk very well. I mean, so, and luckily my job is, you know, an IT job, so there's not a lot of walking, so I was still able to do my job fine, because if I would sit, it would be okay, not a lot of pain. But I couldn't walk, and the foot would flop when I'm trying to walk. It's just incredible.
Yeah, no, I appreciate that. And so it really had an impact on your work, but also your hobbies, I'm sure. It restricted your quality of life with your spouse, who's here, and loyal wife who's here supporting you. I'm sure she suffered with you. I could see it on her face.
Yeah.
Right?
Yep.
It's hard on people when you have a medical problem that you can't find an answer to. Now, were you offered other surgeries for your back?
Oh, yeah, I guess, you know, I did some research. I actually went to, and I probably can't name them here, but I went to 3 different spine surgeons before I talked to you. And 2 of them recommended a 3 or 4 level fusion, and 1 of them recommended that I don't think we can do anything for you, so I wouldn't do anything.
And that's a problem, right?
Oh, yeah.
Because that's not accurate.
I'm convinced that if I wouldn't have done something, I wouldn't be able to walk very well at all, you know, in a pretty short order of time.
Yeah, you would be wheelchair bound. There's no doubt about it. So isn't it surprising to hear that there are doctors who cannot figure out what's wrong?
Yeah, I don't understand.
Well, I've had many network administrators and IT people. Isn't that a great story? He had so much pain relief, that patient. I still remember him. All right, we have just finished a Deuk laser disc repair surgery on 2 discs, the L4-5 and the L5-S1. And this patient has been suffering with back pain from those 2 discs for years. He found us on the internet. He did an MRI review with me, and he's actually from Romania, and really nice guy. But his surgery went perfect. Couldn't have gone better. And I was able to get in there and clean both discs. The L4-5 disc looked like it was a newer injury. The disc wasn't as degenerated. The L5-S1 was clearly an older injury, and the disc was more degenerated and more scar tissue. It took longer to clean it out. Let's take our questions.
The first questions come from Eagle Freedom on Facebook.
Eagle Freedom on Facebook.
I have BCBS basic and you are in the network. Will they cover your laser procedure?
Great.
L5-S1 is severe spinal stenosis.
Yeah. So will Blue Cross Blue Shield cover the laser procedure? Yes, we expect that they will. They may deny the authorization. We'll fight them to get them to pay. They should cover it, but in the end, who knows, right? Insurance companies sometimes deny claims when they shouldn't be denying them. And they do it because they hope that the doctor will not rebill them and just forget about it, or that the patient will just pay and forget about it. But we don't forget at Deuk Spine. We go after the insurance companies to get them to pay. Medicare will not pay at this time for the Deuk laser disc repair. But we are going and getting some success with Blue Cross Blue Shield. We've had Blue Cross pay on several of their plans. The problem with Blue Cross is that they have thousands of plans across the United States. So some plans are really good and they pay, other plans don't pay. And either way, we have to fight them to get them to pay. So the way it works is patients who want to have this surgery done will have to pay an out-of-pocket amount before the surgery. And then we'll bill the insurance. If the insurance doesn't pay after the surgery, we're going to have to fight them. Next question.
Next question comes from Earthbody Official. Going back to my question about cell degeneration by entering the disc with a dilator, do you cause cell damage or degeneration to cervical disc when entering from the front?
Yeah, great question. So the person who's asking is saying, do you damage the disc when you enter the disc in the cervical spine through the front? The answer is no, we don't. The cervical spine and the disc is fibrous. Fibrous means there are fibers, little strands of fibers. You could actually see it if you go back and watch this surgery. You'll see the fibers of the annulus. What we do when we go into the annulus in the cervical spine is we are spreading the fibers apart. Just like when you put a pin in your clothing. You put a pin through the fibers, it spreads the cloth, the cotton fibers. You use the pin, then you take it out later, and there's a tiny little hole, but that hole is not a real hole. All it is done is push the fibers away. Then the hole will close off on its own. So no, we're not damaging the disc or the fibers in any way.
How long does the sympathetic ganglion block last?
So how long does the sympathetic ganglion block last when we do a complex regional pain syndrome, CPRS, diagnostic block? I think it lasts for a few hours. The purpose of the block is not as a treatment. The purpose of the block is diagnostic. The purpose of the block is to find out if the patient will respond to a definitive treatment, such as a ganglionectomy, where we destroy the ganglion. We don't want to go in and do the ganglionectomy just because somebody said I have complex regional pain syndrome. You want to make sure that the treatment's going to work. So you do a block first, and that will verify that.
The next question comes from Aaron on YouTube. Can you treat ankylosing spondylitis with the laser?
Great question, Aaron, on YouTube. Can we treat ankylosing spondylitis with the laser? The answer is no, we cannot. Ankylosing spondylitis is a condition where, unfortunately, your body forms bone that bridges across the disc space and fuses one bone to the next, to the next, to the next, to the next. The whole spine becomes one solid piece of bone. It loses the flexibility. It's basically a disease where the patient's spine fuses itself. We call it the bamboo spine because when you look at the spine on x-rays, it looks like a bamboo. There is nothing I can do for the ankylosing spondylitis patients, unless, of course, they have a fracture of their spine from trauma and then they need a fusion. But the laser will not fix ankylosing spondylitis. It will not prevent it. I have treated patients with ankylosing spondylitis that have a herniated disc, and they had pain from the herniated disc, and I did the laser and it worked. But as far as preventing the fusion of the spine, the laser will not do that.
The next question comes from Earthbody Official. If you have a certain degree of arm or hand nerve pain with the herniation, but no actual motor nerve damage according to EMG, would the recovery of that nerve be faster?
Very good question. So this viewer is asking if they have a pinched nerve and the nerve test shows that there's a abnormality of sensory function but not motor function, would the nerve recover faster after the surgery? The answer is yes. But let me explain. Nerves are little, let's see, let me grab a model here for you. Here's a good one. Nerves, okay, the nerves are these things here, and they're little cables, and they go to the different parts of your body. If you think about your cable internet service provider like Bright House or Spectrum or whatever it is, AT&T, the reason your computer is connecting to other computers and the internet is these cables that go to your house, and they go to everybody's house. And that's what these nerves are. They're little cables, and they allow your brain, like the giant server, the internet, to communicate with the skin on your fingers or the muscles in your forearm, okay, that move and contract. So these nerves have two parts. They have one part that carries information from your skin or your joints and your other, like your tongue, your eyes, sensory information we call it. They carry that sensory information back up to your brain so your brain can understand what you're feeling or seeing or smelling or tasting or hearing. Then the other parts inside the nerve, other fibers, go the other direction. They go the opposite way. So it's kind of like a freeway or highway where you have some cars going this way, some cars going that way, And basically, the sensory information goes back from the periphery, we call it, to your brain. The motor information goes from your brain to your muscles. And this person is saying if the nerve is being pinched, but the motor information is okay, does that mean the sensory side will heal faster or the nerve will heal faster? The answer is yes, generally that is the case.
Is a bulge same as herniation?
Is a bulge the same as a herniation? Thank you for asking that question. Yes, it is, 100%. Our new website is going to show this. Herniation is the real important word you want to remember. Okay? Think about it this way. I don't want to upset anybody, but I'm going to use an example. If I have a 22 caliber bullet, it's a very small bullet. If I have a 5.56 bullet for a rifle, it's a bigger bullet. If I have a 9mm bullet, it's another size. If I have a 45 caliber bullet, it's another size. The point is, there are many different sizes and shapes, but they are all bullets. Everything that happens in your disc is a herniated disc. A small one is a bulge. A bigger one is a protrusion or a rupture or a slip disc or an extruded disc, you know. So there's just different names for the same thing. Just like there's different size bullets, they're all called bullets. Does that make sense?
Yes.
Good explanation?
Yeah, it was a really good
It's the first
explanation.
time I've used that one.
Okay. The next question is, what are your thoughts on the recent trials of novel joint replacement for full lumbar joints?
All right. So the question is, what are your thoughts on the trials for total joint replacement with full lumbar joints? It is 100% a very bad idea. You don't need it. There is no benefit to having that kind of surgery. It is dangerous. It is unnecessary. Could be life-threatening. I assume you're talking about where they're cutting the discs out of cadaver people that die, and they're transplanting them back into living human beings. You will have to be on immunosuppressive therapy the rest of your life, or your body will attack the transplant. Why would you ever want to have a major surgery just to put a disc in there that doesn't hurt? I can fix the disc with the laser surgery in 15 minutes per disc, and it won't hurt anymore the rest of your life. It is totally unnecessary. I would not do it. I would not recommend it. It is honestly, in my opinion, craziness.
My insurance said they don't do reimbursements. How does your team deal with that if trying to fight them afterwards? Do you know anything about United?
Yeah, great question. So another insurance question, which you're going to get a lot of, right?
Yeah.
So United Healthcare is, for those of you who don't know, it is the richest, most powerful insurance company in the world. All right? Maybe Blue Cross is almost as wealthy. United Healthcare makes profit $5 billion every 3 months. That's over $1.5 billion a month in profit. Now, how do they make so much profit? Profit, for those of you who don't know what it means, is when you take money and you spend money as a business, but the money you take in is more than the money you spend. For United Healthcare, it's 1.5 billion. That's $1,500 million profit every month from what? Denying payment for your surgery. I have United Healthcare myself. I had sinus surgery done 1 month ago. When I went to the surgery center, they said, we take United Healthcare. The surgeon takes United Healthcare. But United Healthcare denied my surgery. They said, you don't need it. It's unnecessary, experimental. Bullshit. They went in and opened my sinus so I can breathe. I couldn't breathe in my left side. It was completely closed. How is that experimental? Now, I can breathe. It's amazing. You can't tell me that's experimental. Okay? United Healthcare lies, and they will tell you it's experimental. They don't want to pay. because every time they do that, they keep the money and they make more profit. It's criminal. It should be criminal, but it's not. Unfortunately, the law is written, they wrote the law, by the way, so that they can deny your surgery and they don't get punished for it. Because nobody catches them in their lie. Well, we know they're lying. So what would we do for United? We would sue them, which we're going to sue them, by the way. Yes, we're going to sue them. And I don't know if United will pay for your surgery or not. United has paid for the laser surgery in the past, but most of the time they'll deny it, and we will fight them with appeals, and then we potentially will sue them. So if we don't win, you would not pay anything extra, but you do have to pay some money up front. How much you have to pay up front before your surgery, it all depends on what surgery you're going to have. Are you having 1 disc fixed, 2 discs, 3 discs, 4 discs, 5 discs? Are you having 1 disc on right side, left side, 2 discs, left, right, right? It all depends on what surgery you're having. We have pricing for each surgery. The best thing you can do is do the MRI review, find out what surgery you need, and then we give you the pricing up front. You can know exactly what you have to pay.
The next question comes from W. Stroud on YouTube. Boston Scientific put a stimulator in my back for lumbar disc pain. The trial went okay, and then they installed it. What a total disaster. I had to have it surgically removed. Is this a scam or what?
Yes. All right, Boston Scientific. Listen, I want you to contact us. We are collecting these stories on the scams. Please call Sam at 321-775-1299. 321-775-1299. Tell Sam that Dr. Deuk Majan told you to contact her about the Boston Scientific stimulator scam. Yes, it is a scam. Unfortunately, here's what's happening with the stimulators. Boston Scientific is making these stimulators. They're selling them to the doctors for $30,000. Okay, the doctors are buying them and then charging your insurance and getting paid $50,000. So they're making anywhere between $10,000 to $15,000 profits on each one. Now, rewind the clock 20 years ago when I started doing spine surgery. The spinal cord stimulator market was very small. The only time we doctors ever recommended a stimulator was when the patient was so sick they couldn't have regular surgery to fix them, or when they were like cancer patients, they're going to die soon, you know, and their quality of life was bad. So we would put a stimulator in. They never worked very well, but they were better than having open surgery. That's what it used to be. Now, fast forward 20 years, and the pain management doctors are trying to put stimulators in everybody because the profits are so high from these stimulators that they could put 10 stimulators in one day easy in the morning and they make $150,000 profit. It's unheard of. There's no other surgery in spine surgery that makes so much profit than the stimulators. Okay? And there's an explosion. And now Wall Street companies are buying the pain management practices. Look it up on Google. You'll see what I'm talking about. The Wall Street companies can see so much profit that they're buying the doctors' practices and then they're making the doctors put in as many stimulators as they physically can in one day. So you'll see now, we used to do 1 stimulator every 2 months, 3 months, 1 every 3 months. Now you see these doctors, they're putting 20 stimulators in one day. And the patients, they're recommending it to everybody. It is an absolute scam. We want to stop it. We want people to know about it. It's unhealthy, it's unsafe. So please contact Sam, 321-775-1299, and I would like to personally talk to you about it.
The last question's from Earth Body Official on YouTube. My surgeon was pushing for disc replacement M6, said it came out in 2018. I asked him, there's only 5 years of data? He said I would have to look up the studies. 36% needed revisions.
Yeah, you're right. It doesn't matter what artificial disc you choose. Let me just tell you something, people. artificial discs are a scam. Okay, you don't need them. And what's happening is this crazy stuff. So the first artificial disc, they had a name, right? Let's call it M1. And there were some bad results with the M1. So what does the company do? They make some little changes, and now they call it M2. So now when the patient comes and you say you need M2 disc, the patient says, okay, is that a good disc? Well, they do Google search. There's nothing bad about M2 because it's a new disc. If you look up M1, there's problems, right? Then the M2 is around for a year. It gets lots of problems. So then the company calls it M3, and then M4, and then M5, then M6. So they keep changing the name of these discs, you know, and they're basically trying to throw the patients off the scent. They want you to be confused, and then you see the disc, it's called the M64. Oh, well, look, I Google M64, I don't see any problems. That's because it's so new, right? So they keep changing the name so that you can't find anything bad about it. It's craziness. You don't need a metal disc in your neck or your back. Putting those discs in is dangerous, and having them in is dangerous, and it's unnecessarily dangerous. That's why I stopped doing them. Is that yours? Sorry. I stopped doing the artificial disc because there are so many complications and problems. It is not a good choice for patients.
We have a question from Bob's On-Site Computer Repair on YouTube.
Bob's On-Site Computer Repair. I like it. Are you advertising here, Bob?
Do you accept Medicaid insurance? Brackets, CareSource.
Yeah, we take Medicare, but it's not going to pay for the laser surgery. There's things that Medicare will not pay for, but we do take it. And more importantly, we can do your MRI review for free, so you don't have to pay.
One last question from Earthbody Official. Is Apple making these discs?
Is Apple making these discs? Which discs?
I think it's talking about the...
Artificial disc?
Yeah.
Huh. Oh, yes. I love it. Yeah, I can't stand the fact that Apple keeps changing, right? The phone and the power source, they just keep you spending your money. It is the same kind of idea. It's a moving target, right? So as long as you keep changing the name, then people think, oh, I've got to have that one. So they want to upgrade to the next one. So you're right. It is the same concept. The Deuk laser disc repair that we just did has been around for 17 years. We never changed the name. We've been doing it the same way for 17 years. It's worked for 17 years. We don't hide from it. If you try to do search on Google, you'll see it's great results. All right, I enjoyed our time together. I think that's the last question. Thank you, Sanjay. You did a great job today. And I'm going to get out of here and go home to my wife. It's my anniversary in 2 days. I will be here with you on Thursday, the 12th of October, my anniversary, and I'll be celebrating it with you by doing some surgeries.